Good evening. We follow up on what we said a few minutes ago. When cancer spread to the central nervous systems, when cancer spread to the brain, patients need to be calm and undergo explanation by their cancer specialist. If the patient has good prognostic features, they could live more than 5 years with treatment. The treatment primarily radiation, surgical treatment. If the tumor is superficial and easy accessible, fewer number, the neurosurgeon could excise it and the brain will be followed with radiation treatment, or patient will go for radiation treatment to the whole brain and followed up with stereotactic radiation treatment to the gross tumor seen. Chance of controlling the tumor is good, especially if the tumor is small, and if fewer number, if the patient has good performance status and younger age, and if the diagnosis from time the original cancer was diagnosed to the time the tumor spread to the brain is longer. All these are good prognostic features, and many published data showed those patients could live more than 5 years. We talked also about if patients with cancer who developed back pain, especially if they start to develop leg weakness or weakness depending on the level of the pain. If the pain in the neck, they could get arm and leg weakness. If the pain in the back, they will develop weakness in the legs only. If such thing happen, they need to rush to the emergency room because this weakness will continue until they are paralyzed. It could take hours, it could take days, it could take weeks before they are completely paralyzed, depending on the aggressiveness of the tumor. Once patient arrive the emergency room, they do MRI or whatever diagnostic measure they do. Once they recognize it, they see the tumor, you are seen by neurosurgeon who could operate on you, or a radiation oncologist who could treat you with radiation, and the outcome usually good if the weakness is minimum or if it is early. If the patient have complete paralysis, reversing neurological symptoms is very small. If the patient have 50-50 weakness, usually recovery is 50-50 or somewhere there. So it's so important to recognize what we call it spinal cord compression. The area below the spinal cord, or we call it coda equina compression, which is the nerves compressed at the lumbar and sacral area, that also lead to weakness in leg muscles. Recognizing spinal cord or coda equina compression early is the key of preventing paralysis. Again, treatment is not guaranteed, but that offers the patient the best option. There is a third category where the tumor go to the brain or go to the spinal cord and the brain, what we call it, the tumor spread to the meninges. The meninges is the layer covering the brain and the spinal cord. This condition is the worst condition, and we call it meningeal carcinomatosis. And this, many times you do MRI of the brain and spinal cord, you just see some enhancement, whitening, enhancement on the MRI, and this meninges or these sheets cover is loaded with cancer, but we can't see it because only cells. Those patients, they get weakness, they get what we call a nerve. You see the cranial nerves or the nerves of the face get paralyzed, and they start to get weakness. You do CAT scan, MRI of the brain, MRI of the spine, you see nothing. how you diagnose those patients? You do lumbar puncture. The fluid around the brain and the spinal cord will have the cancer. Sometimes you do that and you don't even see cancer in those fluids, even you do 3 times. So even though this cancer is there, but we can't see it. We can't see it radiologically. We can't see it morphologically. When we do lumbar puncture and look at the individual cell, sometimes we don't see it because those cancer, they erode from the meninges to the nuclei of the cranial nerves and cause paralysis of them, and they go to the anterior horn cell where the cells of the spinal cord, they destroy them. So patient end with paralysis of the cranial nerves and the muscle of the body. This condition is grave, outcome is bad. The treatment either combination of chemotherapy and the brain radiation, chemotherapy injected in the fluid around the central nervous system, or the cerebrospinal fluid and the radiation to the brain, or we sometimes treat those with whole brain and spinal cord radiation. This condition, meningeal carcinomatosis, is very aggressive, and the treatment palliate those patients, extend their cancer from a few weeks to maybe a few months. The good news, this condition is rare. We don't see it often. We see most often the tumor spread to the brain, and if the patient from the good prognostic feature, they live more than 5 years, and as a matter of fact, some patients live even more and more with the right treatment, which include treat the whole brain, remove the tumor surgically, or do a stereotactic treatment to this tumor. Both treatments are successful, and if the patient from good prognostic feature, they live long time, God willing, and they enjoy their life. So I briefly summarize: if the tumor come to the brain or spinal cord, a patient need to rush to their physicians for early diagnosis before damaging nerves and cells. Those damage, if the damage is complete, is irreversible. So we hope they are seen at a stage before the damage is complete. When the tumor compresses in the spinal cord, the swelling itself will do the pressure. Patients start to have weakness. When the weakness is early, they start with giving them Decadron to decrease the pressure, then diagnose it and the treatment, and usually it's reversible, and majority of patients will do very well. If those patients come to the emergency room late after complete paralysis, the damages happen and the chance of reversing it is very small. So it's so important for you to recognize symptoms of spinal cord compression, symptoms of brain metastasis, for early diagnosis, better outcome, and hopefully much longer life expectancy.